From Wits and Weights, I'm Philip Pape, and this is Nutrition Science Daily, bringing you the latest in nutrition, fat loss, and health science, all in under 5 minutes. Today, we're looking at a major challenge facing aging populations: malnutrition. It's a silent issue that often goes unnoticed, but has serious consequences for health and quality of life. New technology from researchers at Toulouse University Hospital offers a groundbreaking way to detect and prevent malnutrition in older adults. Let's dig into the details. Malnutrition isn't just about being underweight. It can occur even in individuals who appear to be eating enough. As we age, factors like reduced appetite, changes in taste, chronic illness, and medication side effects can make it harder to meet nutritional needs. This often leads to muscle loss, immune decline, and slower recovery from illness or injury. To address this, researchers at Toulouse University Hospital have developed an innovative health monitoring system that integrates multiple assessments, including body composition analysis, dietary tracking, and physical performance tests. The goal is to identify early signs of malnutrition before it causes significant harm. Here's how it works. The system measures key health indicators like muscle mass, grip strength, and nutrient intake. These metrics are then analyzed to provide tailored recommendations for dietary and physical activity interventions. For example, if a patient shows signs of low protein intake, the system might suggest increasing lean meats, dairy, or plant-based protein sources in their diet. So why is this important? Well, malnutrition is a major driver of frailty in older adults, which increases the risk of falls, hospitalization, and reduced independence. Early intervention not only improves quality of life, but also reduces healthcare costs. Now, this technology is promising, but of course it's not yet widely available. It might also be expensive when it is. And in the meantime, there are steps we can all take to prevent malnutrition in ourselves or our loved ones. I'm going to give you 4 tips here that are super important, so please pay attention. Number 1, prioritizing protein. Protein is essential for maintaining muscle mass as we age. Period. Aim for protein-rich meals that include foods like eggs, fish, poultry, beans, dairy. There are so many sources of protein, and most human beings get far less than they need, and you need even more as you age. Number 2, focus on nutrient density. So when we talk about malnutrition, part of that is in the word. Mal, as in bad or lower than we need, nutrition, right? So incorporating a variety of colorful fruits, vegetables, whole grains, fats to ensure that you're meeting your vitamin and mineral needs is super important. Number 3 is to monitor how much you're eating and your appetite. And in this case, it's the opposite of what most people need this for, because older adults often eat smaller portions. They are less hungry. So we need to, in my recommendation, track our food if we're not sure, if we're trying to help an aging, say, parent or adult in our family, really to track them so they understand how many calories are they eating, how much protein are they eating, right? And then how do we increase that? And some of the techniques from not bodybuilding, but muscle gain, where we're trying to eat more food, might apply to this population, where smaller, more frequent meals or snacks can help them meet their energy and nutrient requirements, and then more nutrient and calorie dense foods as well. And then number 4, and honestly, I should have put this at number 1, but since we were talking about nutrition, I wanted to start there. And that is to encourage physical activity, but not just any activity. Resistance training. Strength training is probably the number 1 thing people are not doing in the decades leading to older age that will build and maintain muscle and bone health and effectively avoid much of what we are talking about in today's episode and prevent frailty. So even simple changes like just adding a scoop of protein powder to your oatmeal or blending leafy greens into your food, can make a difference over time. So start somewhere manageable and bite-sized and work from there. All right, so my final thought here, and I kind of alluded to this already, is nutrition is just one piece of the puzzle. We talked about strength training as well, but there's another factor, and that is social factors. Isolation, difficulty shopping and cooking. These also affect malnutrition, especially among older adults. And if we can address these barriers, whether it's in a community meal program or enlisting support from family members, that can make a huge difference. And so the bottom line here is malnutrition is utterly preventable. And new tools like the one from Toulouse University are pretty cool. It's paving the way for earlier detection and intervention. But the foundation of good nutrition starts with awareness and proactive habits. And whether you're an older adult yourself listening to this or supporting someone who is, small steps can lead to big improvements in health and independence. And I would encourage you to help someone in your life who needs that support. If this episode inspired you to think about nutrition for healthy aging, check out my main podcast, Wits and Weights. I dive deeper into evidence-based strategies for optimizing health, body composition, and strength and muscle. Follow the show wherever you listen to podcasts and share this episode with someone who cares about the well-being of older adults. Tomorrow, we'll wrap up the week with a fascinating look at how artificial intelligence is transforming personalized nutrition advice. Don't miss that episode.